Good afternoon. We're going to speak today about the process and importance of recovery in evidence-based treatments in mental health. Um, this video is for mental health experts, but also for non-mental health experts, and especially for people who seek for psychotherapy. I'm going to share with you a PowerPoint presentation so that I can better explain the recovery and its role in pharmacotherapy and psychotherapy. So, well, the end outcome of evidence-based treatments in mental health is recovery. Is the only objective outcome that every pharmacotherapy and psychotherapy must reach. So the recovery as an outcome or objective recovery is the result of a test that we administer. As mental health experts, we are obliged to have objective results regarding the context before, after the treatment, and in follow-ups. So we administer self-tests and tests which are associated with a clinician evaluation. And the combination of self-test and clinician evaluation tests lead to an objective result, especially after treatment or in a follow-up. So we follow evidence-based psychometric evaluation, and we focused on psychopathology, quality of life, and functional outcome. When these categories are improved, then we will have a bigger chance to reach a very good example in a recovery context. Recovery as a process or subjective recovery is the point of view of the clients, the point of view of families of the clients. That means that people and families are responsible towards their own problems. They participate in an active manner on their own problems, and they are the protagonist of their own life. So this is a dynamic procedure. That means recovery, objective and subjective recovery, are different point of views, but both of them are very, very important in the context of the dynamic therapeutic relationship and alliance. Recovery, objective or subjective, means that as a protagonist of my problems, or as a protagonist, I take care of myself, I take my responsibility towards my own problems. I try to follow I try to reach important goals of my life. I try to engage in activities in which I can improve my mood, I control my problems better as in the past, and I am a social person. I am an active member of the society through social interaction. So we begin with an evidence-based pharmacotherapy, psychotherapy, and rehabilitation. We have the recovery as an outcome before, after the therapy, and in a follow-up. Then we have recovery as a process before, after the therapy, and in a follow-up. This is a dynamic context because clients and therapists interact and discuss these points of view and exchange opinions regarding progress or problems. So mental health experts need the clients and their families, especially by chronic mental health disorders, in order to cooperate better. And this is in favor of a positive results in psychotherapy. That means that mental health experts are not gods, are people with an expertise who have the responsibility to guide clients with mental health disorders to a positive solution of the problems. And this encourages a dynamic context. And as a result, a dynamic context with interaction and with exchange of the different opinions is a democratic context. So, psychotherapy should be democratic, should be evidence-based, and should be evaluated through recovery as an outcome and through the recovery as a process. So when you choose to make a psychotherapy, you have to remember this presentation. So this presentation is the best answer to many questions that clients ask when they come to the first session to us. I can describe some examples. For example, they say, you know, I have spent 20 years of my life doing long-term psychotherapy. I didn't understand what this psychotherapy did, how this psychotherapy helped me. I didn't understand why I should be in a long-term psychotherapy. And until now, the only thing I have understood is that I had a bad relationship with my parents. So this is a very good example of a nicht transparent context, of a not evidence-based context of psychotherapy. So the evidence-based psychotherapy and pharmacotherapy contains the following steps. In the first two sessions, you're going to be asked about the past and the present problems. Then you have, we administer tests And then we talk about the goals of the psychotherapy. During the first 20 sessions, we have a good picture of your problems and what can we do against them. And after the 20 sessions, it is clear that psychopathology can have comorbidities. For example, when you suffer from depression, from treatment-resistant depression, and you have been sexually abused in the past, then the trauma has a negative impact on depression. So you have to make a therapy about trauma, and you have to learn to cope with your treatment-resistant depression. And it is a frequent phenomenon, the fact that many mental health disorders are associated with personality disorders. For example, when a person have been confronted with a trauma for many, many years, then it is very possible that the personality that has been developed is not functional. For example, borderline personality disorder or dependent personality disorder, or a mixture of components of personality disorders. So in 2 or 3 months of evidence-based pharmacotherapy and psychotherapy, you can understand what is your diagnosis, why have you suffered from your problems, and what can we do. During these 20 sessions, we focused on anxiety and depression. Then we go on with traumata, if they are there, if, for example, PTSD is fulfilled as a diagnosis. And then we go to personality disorders. During this procedure, recovery is the main focus. We try to improve psychopathology, functional outcome, quality of life, and recover. Or when we improve psychopathology, quality of life, and functional outcome, then we have a bigger possibility that we can reach recovery. Well, even in severe mental health disorders, evidence-based psychotherapy should help people in 3 to 4 years. You don't need 10 years psychotherapy. You don't need 20 years psychotherapy. This is something that is not evidence-based. So when you are visiting a psychologist or psychiatrist that want to do a psychotherapy, you have to ask your therapist, have you been trained in any psychotherapy? Can you show me the license? Can you show me the an improvement that you are a licensed psychotherapist? And after that, you're free to begin with this therapy. The first and the most important thing is to build a therapeutic relationship and alliance. And even if the therapists are perfect and very good and very famous, it is possible many times that you don't, you cannot build a therapeutic relationship or alliance. This is very subjective. So your focus on whether you build a therapeutic relationship and alliance is whether you are feeling good with this therapist. On the other side, the cognitive behavioral psychotherapy and rehabilitation is very interactive, and you have to take responsibility for your own problems. If you are not able to take responsibility for your own problems and to work your own problems, then you have to leave psychotherapy and begin with it in another time or next year. So if you're not motivated or if you don't want to change some things, you have to criticize yourself. That's the reason I said during this presentation that psychotherapy and evidence-based treatments are an interactive context. Without your contribution, it is not possible to carry on with the therapy. So today, people in all over the world are confronted with stress, with depression, with traumata, with dysfunctions of regarding personality disorders. But if you're willing to change yourself or to try to change yourself, evidence-based treatments who lead to recovery are there for you, are available for you. So you have to think about after this presentation if you want to begin a psychotherapy or not. So for us, for mental health experts, every person in every psychotherapy is a unique personality. I'm very glad, I'm very happy when I meet you during my psychotherapies, when you give me the chance to know you better and to propose alternative solutions to your problems. I'm an expert. I have trained myself for many years. I have gone through many psychotherapies and many research protocols, but I'm not a god. But if you come to begin with a psychotherapy, it is for me a new beginning. And I'm very proud of you if you try to change yourself. So, evidence-based treatments lead to recovery, and they are the only treatments who can give us answers to your problems. Long-term psychotherapies over 5 years, 10 years, 20 years are not evidence-based. So, it is very important to know the evidence-based context of a scientific psychotherapy. The end goal of a scientific psychotherapy and pharmacotherapy is recovery. I wish you all the best, and I will be very happy if you begin a psychotherapy by me. Thank you very much.